So, OMT, Testao, Dragon, Happy Chinese New Year's! But in reality, so this video is going to be about what OMT is, and Dante and Lawrence are going to have a little discussion about everything that we've drawn here. And then, for the record, OMT, Osteopathic Manipulative Therapy. Then afterwards, in the second half of the video, we're going to talk about why OMT is relevant to us, why we do it, why it's important to us, and why it's awesome in general. So stay tuned. You'll hear from them very shortly.
Today's video is going to be what is OMT and why is it awesome? We originally had a different version of this video and we were going to post it yesterday, but then, well, one of the commenters was kind of like, talk about why it's awesome, and we require art. So, art happened. Deal with it. It's there. Awesome. One of the issues with, first of all, OMT is an acronym. It describes Osteopathic Manipulative Therapy, and one of the big issues with it is ultimately every definition of that word has been kind of vague, dodgy, diffuse. We would refer to it in context of other things or as an adjunct to this, that, and the other thing. But it was hard to find an actual way to talk about what it is in its own right. So what we did as a little group of us was discuss and kind of agree on like an internal definition of what OMT is. Talk about it.
Yeah, so a lot of us try to recognize this as manual therapies, as a combination of different manual therapies rather. So looking at just the picture, so we have here like physical therapy, soft tissue, so encompassing things like massage, what you think of massage, so things like the Swedish massage, those types of things, and exercise medicine, being things like doing Tai Chi, kind of stretching, strengthening yourself, all that encompasses this. Chiropractic therapies, so what you typically think of as when people crack your back, crack your neck,
right?
All those types of things.
Yeah, because one of the issues we had when we were actually trying to hash out this definition, one of the issues was we couldn't find a way to differentiate what we do from, like, there was no way to talk about OMT without talking about cracking backs. It just wasn't going to happen.
Yeah.
Likewise, we can't really talk about OMT without talking about how, yeah, we kind of do massage things too, and trying to separate those fibers and trying to separate those ideas and like try to tease out what it was. It made no sense to try to pull them apart and say this is what OMT is at its core. It made more sense ultimately to say that OMT is a sum total of all these things. And it's kind of where we end up with that.
Yeah.
But what made it different ultimately from just being soft tissue plus chiropractic plus exercise, physical, energy, and so on and so forth was the people who do OMT, like we're med students, and hopefully in a few weeks I'll be a doctor, and
another year,
a few weeks in a year we'll be a doctor. So all this is kind of backed by the fact that we're also trained at a medical grade. So, I don't know. Can you imagine any of what we do working if we didn't have as big of a knowledge on, you know, just straight up A and B, like anatomy and phys? Or let's try this simple question. How much time did you spend doing anatomy as a first year medical student? How much legit time do you have to sit over a goddamn cadaver and just stare at it until it was burned into your like goddamn retina?
Way too long. More than most people would enjoy spending at a dead body.
Kind of. And it's not like it's a bad thing, but I feel like that's part of the advantage. It's part of what makes this thing unique. It's PT with 400 hours of anatomy and phys. It's soft tissue with 400 hours of anatomy and phys. And 400 is by no means an exaggeration. That might actually be an understatement, which is kind of sad, to be perfectly honest.
Yeah. And although, like we were talking about before, physical therapy and maybe like other fields like it do spend time with anatomy and physiology, they don't necessarily spend as much time with additional training to further ingrain it and encompass everything else that it might be related to.
Yeah, and so bouncing off of that, one of the issues became fine. All of that's OMT, but what are the actual bounds of it then? So when we were discussing it with a couple of other peers, the thing became, so what about like I don't know, steroid injections or lidocaine stuff, like the actual TPI component, using needles and injecting substances, sclerotherapy and stuff like that. Would we feel comfortable calling it that versus, you know, acupuncture and so on and so forth? So we kind of started trying to figure out what the bounds of it are. So what would you draw the line? Like, where would it stop being OMT? Where would it start being physical medicine as a greater spectrum of things? Yes, I'm putting you on the spot.
My argument would be probably along the lines of when you stop using your hands directly on the patient.
Okay. And I agree with that line. It was something we were trying to kind of work out, and we've worked with doctors who are actually able to use these principles and these techniques with a needle in their hand, like somehow blend the two ideas of acupuncture and OMT.
Right.
And I'm not saying that's invalid or by any means wrong, but at the same time, the fact that he had to comment that they were being blended still marks that they were separate entities in the first place, that now it's being advanced into something else. I guess ultimately, after all of that, we came to a bit of a, more straightforward definition, hopefully one that makes sense in the context of this, the sum total of all things, these manual therapy techniques plus medicine, so on and so forth, and I just read it.
So, our final definition we came up with was along the lines of, as I'm reading off here, OMT is the use of various manual therapy techniques combined with medical understanding of anatomy and physiology in order to optimize the human structure and function.
And that's kind of our position. So with that out of the way, the next part is straight up, so why is OMT awesome? Because fine, you can do all these things, but, well, just because you can do something doesn't exactly tell you why. So the next part of this video is going to be pretty much explaining why this is worthwhile, why this is valuable.
Okay, so
Or talk to me.
all right, so the reason I love OMM, it really emphasizes our philosophy of the mind, body, and spirit working together as a unit. So someone comes in, their spirit's low, their mind is all over the place, they're really distraught by this injury. So basically, we're using our hands to diagnose and treat. And I personally think it builds a whole different level of trust and a new level of relationship with every patient. Because it takes a lot of trust for someone that you just met to put their hands on you. So if you really trust someone to work on you like that, I think that establishes a whole new connection that you don't really get in any other type of practice. And just OMM is fantastic for not just the spine, but also the whole musculoskeletal system working together. That includes the nervous system, lymphatics, blood flow, and basically it just emphasizes how the whole body's interconnected. So if somebody has a headache, we could take a look at your lumbar sacrum area, because we're trained to think how the whole mind, basically how your whole body works together as a unit.
You're really using your hands to treat the patient. We're not just giving you medication to, mask your symptoms or anything. We're treating the root cause of it. Really, patients can walk in and feel relief the first day they come in, and they really feel a lot of relief. Say someone walks in with back pain, can easily, within 15 minutes, get my hands on the patient, find out which way their vertebrae and what muscles are kind of hypertonic and which muscles are painful. And I can do a few techniques to really relieve pain. And patients really do walk out of the office with less pain than when they came in, all on the same day.
In between my first and second year of medical school, I went on a mission trip to Ecuador, where we stayed in a poorer city where they don't have a lot of good health care. So when we went down there, we were able to shadow different doctors in various clinics. So the one clinic that we had gone to, this guy came in who had really bad back pain. His job was to pick up these like 10, 20 pound cement bags and carry them over his back. So as you can think about, if you're carrying this for miles, it's going to hurt your back. So he came in and he was basically hunched over like this, and he was like, I can't really do my job. If I can't do my job, I'm not going to be getting paid. I'm not going to be able to provide for my family. So the doctor asked us, like, oh, can you, check him out and see if you can do anything for him. So I was the first year. I had no idea, very, very limited knowledge about OMT. Besides maybe like 20 techniques we were taught in first year. So me and one of my other classmates, we checked him out. We found that he had an innominate problem, a low back problem, stuff wrong with his sacrum. So we treated him for about a half an hour, and after the half hour, he was able to sit up a little bit straighter and just kind of was like, what did you do? Like, why? How can I now kind of move a little bit? So the next 3 weeks while I was there, he came in once or twice a week, and we were able to treat him a little bit further. And each time he was able to actually sit up straighter. He was actually to walk further when he was doing his job. And he actually invited us to go dancing with him because he felt like he was so much looser, he was so much able to move more, and he owed all of that thanks and gratitude towards us being able, with our little baby first year knowledge, to help out. So that's why I knew that I had to do OMT and be like super involved with it. And go OMT.
So, as we conclude from all the videos, everyone's quality of life is improved in various ways, whether we're making it easier for people to move, so we're increasing their range of motion.
Yeah.
That we decrease their pain, amongst other things, that basically we're enabling people to do the things that they want to do, but better, easier, however you want to say it.
And that makes it awesome. Like, easy question, why is it awesome? Because you hurt less. You do stuff better, you know what I mean? And, well, I don't know, for me that's inherently awesome. So
Summing it up.
yeah, like if, I don't know, if you're ill, or if you have whatever pathology, like if you are suboptimal, we can make you healthy. And if you're already healthy, we can just upgrade you. So sick to fine, fine to, we can make you thrive. Upgrades, because apparently we're mechanics today. OMT is awesome because we can upgrade you.
Let me upgrade